What's a open fracture in MC site? Fracture plus break in skin, soft tissue. MC site, tibia plus phalanges. Staph aureus infection risk. Classification of open fractures. Gastillo, Anderson classification. Type 1 wound less than 1 cm. Type 2 wound 1 - 10 cm. Type 3A open environment, sewage, farms, firearm. Type 3B periosteal stripping. Type 3C vascular injury. Management of open fractures. Wound management more imp than fracture. Antibiotics plus wound closure plus wound toilette. Fracture management. Wound closure for open wounds. 1. Primary closure, only in clean wounds. 2. Secondary, delayed, if after 6 to 12 hours. Or neurovascular injury. Fracture management of open fractures. Grade 1 like a closed fracture. GRDE 2, 3A, if clean then like closed fracture. Otherwise like open. Grade 3B, 3C external fixation cause internal fixation may cause growth of microorganisms and biofilms in open fracture. What pins are used for external fixation in open wounds? Schon's pins placed proximal and distal to wound and they immobilize bone. Types of external fixation. 1. Rail fixator, limb reconstruction system. 2. Alizarov ring fixator. 3. Spanning external fixator. Most stable external fixator. Alizarov ring fixator. Steps in Alizarov ring fixator. 1. Corticotomy cut the bone. 2. Clotaxis stretching of callus and new bone formation. 3. Distracting the rods in normal physiological limits. 4. Growth of new bone. Normal physiological limits of distracting the rods in Alizarov ring fixator. 1 mm per day. Spanning external fixator use. Periarticular open fracture. What's ring sequestrum? It's a complication of external fixators in open wounds. Here there is necrosis of site where pin is attached due to infection heat or drilling. Amputation and disarticulation. Amputation, cutting the limb off the body through the bone. Disarticulation, cutting the limb off the body through the joint. Indication for amputation. 1. Crush injury or RTA. 2. PVD, diabetes. 3. Frostbite, gas gangrene, malignant tumor. 4. Congenital absence or neuromuscular disease like polio. Trauma scores for amputation. 1. MES mangled extremity severity score. 2. Limb salvage score. 3. Ganga score. MES mangled extremity severity score criteria and cutoff value. Value equal or more 7. VISA, V velocity of injury, I ischemia time, S shock, A age of PT. Types of amputation. 1. Closed amputation, skin is closed. 2. Open guillotine, skin kept open, in infected, contaminated, ischemic wounds. While amputation, bone has to be cut how shorter as compared to soft tissue. 5 cm shorter. Methods of closure in amputations and indications. 1. Myotasis, suturing muscle to bone, CI in PVD. 2. Myoplasty, muscle to muscle, done in ischemia PVD. Skin flaps type in amputation. 1. Skewed flap post. Flap is longer than anterior. Suture line anterior to mid-coronal plane. 2. Symmetric flap, anterior and posterior flaps are of same length, suture line on mid-coronal plane. Which type of skin flap is better for limb prosthesis? Skewed flap. What's the amputation through shoulder girdle is called? Forequarter. What's the amputation through digits is called? Ray amputation. What's Krukenberg amputation? It's to separate radius and ulna in blind people so they can use them as pincers. What's the amputation through pelvic girdle is called? Hind quarter. What's the amputation through ankle is called? Symes amputation. What's Gritty-Stokes amputation? It's distal femur amputation. It's closed with patella and soft tissue. What's Chopart amputation? Intertarsal joint amputation. What's the amputation through tarsometatarsal joint is called? Lisfranc. Complications of amputation. 1. Amputation neuroma. 2. Phantom limb. 3. Infection, bleeding, flap necrosis. Amputation neuroma. It's constant pain at amputation site. When nerves are not stretched and cut under tension. Management, surgical best, electric stimulation, or interferential therapy. Phantom limbs. Point feels amputated limb is attached to body. Sensation disappear in distal to proximal fashion. Prosthesis and orthosis. Prosthesis, device that replace normal anatomy. Orthosis, device that support normal anatomy. Types of terminal devices of prosthesis. 1. Jaipur foot, heel is flexible. 2. Sacked solid ankle cushion heel, foot solid ankle, don't allow movement. Difference between Jaipur and sack foot. Walking barefoot, squat, inversion aversion, mobility all possible in Jaipur and absent in sack. Sack is costly and don't look normal. Amputations in children. Save as much bone as possible. Disarticulation preferred. Adapt well to prosthesis. Implantation of limb indication and order of reconstruction. Clean wound with mess score low. Be fan of Virender Sehwag. Bone, external tendon, flexor tendon, artery, nerve, vein, skin. ATLS what an indications. Simultaneous diagnostic and therapeutic activities to identify and treat life-threatening injuries. Indication, non-cardiac arrest, with polytrauma. Component of ATLS. Airway, breath, circulation, disability or neurostatus, exposure and environment. What's a Philadelphia collar? It's to stabilize the cervical spine. Management of pelvic fracture. 1. Pelvis binders. 2. IV fluid RL greater than NS. 3. External fixation of pelvis. What's damage-controlled orthopedics? It's limited surgical intervention to control hemorrhage and contamination in unstable patients, e.g. point with fat embolism, chest injury, coagulopathy, hypothermia, severe acidosis. Crush syndrome pathogenesis. Compression hypoperfusion and myocrosis, toxic metabolites accumulate, release of compression, metabolites release and cause reperfusion injury, acute tubular necrosis, renal failure, acidosis, hyperkalemia, hypocalcemia. Management of crush syndrome. 1. Fluids. 2. Alkalization of urine by sodium bicarbonate.